and Sathiyalatha Sarathi, Professor, Sri Balaji College of Nursing. Welcome to the presentation on research process. Before move on to research process, first we'll see about the definition of research. What do you mean by research? Research is a scientific, systematic, controlled, orderly, and objective investigation to develop, refine, and expand the body of knowledge. Research is a scientific. Scientific means any concept which has to be proven by scientific method. Systematic means the research methodological process has to be involved. Control means the research variables should not be changed. So that is called as control. And usually in experimental group, we will have the control group. Why? Because this control group is enhancing the study results. Orderly. Next is the orderly. Orderly means one after the another. We have to follow the research steps, starts from the statement of the problem, and then finally we have to end up with the disseminating the research findings. And objective investigation. Objective investigation means, and anything we have to check by using the instruments. So, for example, checking the temperature. The patient will say that I am having the fever, but we do not know how much temperature the patient is having. So we'll be checking the temperature and says that the patient is having 100 degrees centigrade or 101 or 102. So anything has to be checked objectively. So we call it as the objective investigation. So research is required for to develop, refine, and expand the body of knowledge. So overall, research is defined as a scientific, systematic, controlled, orderly, and objective investigation to develop, refine, and expand the body of knowledge. What will be some of the characteristics of the research? And order and control, empiricism, generalization, and theory. Order and control is already present in the definition of research itself. Order means it starts from the first step, formulating the research statement, and finally we are end up with utilizing the research findings into the practice. So from the beginning to the till end, we have to follow all the research steps. And next is the control. And control means the study variables should not be affected by the extraneous variables. So the investigator should have the control group. Empiricism means it's the objective evidence. Subjective evidence is to be not supported in the research. We have to go for the objective evidence. By the research tool, we have to collect the data in case of the quantitative research. And next is the generalization. Generalization means the research findings must be applicable to the general population, either the drug therapy or any vaccine which has to be discovered, it has to be applicable to the general population. So that we call it as the generalization. And next is the theory. Theory means the concepts what we have discovered or designed that has been represented through the theory. Okay. For example, Lydia Hall's care, core, and the cure concept. Okay. The concept has been represented in a theory form. So these are some of the characteristics of the research. One is the order and control, empiricism, generalization, and theory. Purposes of the research. Okay, the general purpose of the research is to answer questions or problems or solve problems of relevance to the nursing profession through identification, description, exploration, and explanation. Identification. Identification means, and what is the phenomena in depth? We are studying in detail about a phenomena. What is the causative organism of a particular disease? What is the morphological structure? Which part of the body it has to be affected? What clinical manifestations has to be represented? So in detail, we are studying about particular causative agent. So this is, we call it as the identification. Next is the description. Description means descriptive investigation by observation, counts, describes, and classifies. It means that we are classifying the sometimes disease. Example, diabetes. According to the insulin dependence, we will be classifying into insulin dependent diabetes mellitus and the non-insulin dependent diabetes mellitus. According to that, the management strategies will be vary. And same like according to the severity of the disease, anemia, mild anemia, moderate anemia, and the severe anemia. So this description explains or describes the classification. Next is the exploration. Exploration means exploring the relationship between the two phenomena. Example, it's smoking causing the lung cancer. Smoking is one of the risk factors that may be having the possibility to cause the lung cancer. So these two variables we are studying. So that we call it as the exploration. Now next is the explanation. Explanation research is deriving, organizing, interpreting ideas about the manner in which phenomena are interacted. So here the pathophysiological process of a particular disease has to be explained in detail, and which part has to be affected in the body, and what complications and what clinical manifestations are represented by the pathological disease process. So this has been represented by the explanation. So by identification, description, exploration, and the explanation, as the investigator and the researchers, we are able to do a appropriate nursing diagnosis or a medical diagnosis, and plan for the management strategies and the preventive measures to control the disease process. So that is the purposes of research. Next, we'll move on to introduction to a research process. In quantitative studies, researchers move from the beginning point of a study, the posing of question, to the end point, the obtaining of an answer in a reasonably linear sequence of steps that is broadly similar across the study. So whatever the studies that we'll start with, starting is making a question and then posing that question, and we are ending with an answer. So, and making a statement of the problem until getting the study results, the investigator or the researchers have to undergo a sequence of steps, and totally 18 steps are there in the research process. This steps has to be carried out one after the other. So that sequence of research steps, we are call it as the research process. Next, we'll move on to phases of research process. There are 5 phases out there. One is the conceptual phase. Second is the design and planning phase. Third is the empirical phase, and fourth is the analytical phase, the dissemination. Fifth one is the dissemination phase. Conceptual phase means the concept of a particular research problem has been studied in detail. And the second phase is the design and the planning phase. The appropriate research design has been selected and how the research has to be conducted. So the research planning has to be done. And third is the empirical phase. So in this phase, the implementation of the study has to be done. The analytic phase, whatever the data has been collected in the empirical phase have been analyzed. And next is the dissemination phase. The study results are disseminated by communicating the study findings, by presenting the scientific paper or publishing the articles in the journals. So overall, the research process is having the 5 phases. Next, first we'll see the phase 1, the conceptual phase. Formulating and delimiting the problem and reviewing the related literature, undertaking the clinical field work, and defining the framework or developing the conceptual definitions. And the fifth one is the formulating hypothesis. So conceptual phase includes the all 5 steps. Step 1, we start with the formulating and delimiting the problem. One of the first things a researcher must does identify an interesting, significant research problem and a good research question. And another one, a critical ingredient in developing research question is the personal interest. So here, according to the researcher's personal interest, we will be formulating a research problem, and also the research problem should be more suitable at the present situation. So in that way, and we have to formulate the research question. When we are formulating the research question also, we have to see the delimitation, because the research study cannot be conducted in the broader aspects. Okay, we should have a limited setting, and many settings it's not possible. So, and according to the possibility, we have to limit our study to either one hospitals or two hospitals or three hospitals or one community setting or whatever it is. So this is called as the delimiting. And which age group we are going to do for that school children between the age group up to 12 to 15 years or whatever it is. This is depends upon the condition. For example, the breast cancer, usually we will do for 30 years to 45 years, because the incidence of the breast cancer will be more between the age group of 30 to 45, so that we will delimit our study. So that is the meaning of formulating and delimiting the problem. The second step is the reviewing the related literature. Extensive review literature is obtained from textbooks, journals, magazines, newspapers, conference proceedings, government documents like WHO guidelines, resources, PubMed, and Cochrane database. These all are the international internet access, so that we are able to get the study materials. These help for the strengthening our research process. The researcher will be gaining the good and background knowledge about the theory, so that is easy for her to build her study in a better form. Step 3 is the undertaking the clinical field work. Spending time in clinical settings, discussing the topic with the medical professionals and healthcare administrators, and observing current practices, such clinical field work can provide perspectives on recent clinical trends. And previously, we have seen about the theoretical knowledge, and in the step 3, we have to strengthen our practical knowledge also. Before going for a study, and the investigator has to be work in the clinical area, and they have to thorough about the procedure which they are going to do. For example, the researcher is going to do a cervical cancer screening first, and she has to develop the skill in doing this cervical cancer screening. She's able to put a speculum, and she is able to visualize the cervix. So then only that is possible for her to go for a cervical cancer screening. So this is the skill which we have to develop before going undertaking the pilot study. So that is the step undertaking clinical field work. And step 4, developing conceptual framework. The researchers must have a conceptual, rational, and a clear sense of concepts under the study. And developing conceptual framework provides skeletal plan for the research work. We developing conceptual framework, it's giving a skeletal structure of the entire research process. For example, Lydia Hall's care, core, and the cure concepts. Okay? And which concept the investigator is going to apply has been represented through the theory. According to her research problem, she has to choose for any type of theory. And for example, Lydia Hall's care, core, cure concepts. Okay, so in that, the researcher is doing any intervention study like experimental study. In that case, she's going to do her intervention, and then she's going to evaluate her intervention. So here the person is considered to be a core, and then the body is to be a care. Nursing care has to be required. and the disease process is to be the cure, the medical treatment. So in the care, in the nursing care, the nursing intervention which she is going to do for her patients, for orthopedic patients, okay, she may be giving for any exercises program. So that will be the intervention for her. So she will be evaluating her intervention so that so she will be representing her concepts by applying the rehearsed care core and the cure concept. So all these three concepts are integrated together so that the patient will be getting cured. Okay, so this is the concept about the formulating the conceptual framework. According to the dependency level also, the investigator can choose the theory. For example, self-care deficit theory. This theory is more warm self-care deficit theory is more applicable for dependent patients, okay, because they need the all the care that has to be satisfied in the bed itself. So it is according to the condition of the patient, the theory has to be chosen and it has been applied in the research work. Step 5 is formulating the hypothesis. The hypothesis is a statement of the researcher's expectations about the relationships with the study variables. Hypothesis, in other words, are predictions of expected outcomes. Hypothesis is the relationship between the two variables. Okay? So that has to be studied. For example, it's a relationship between the knowledge and the practice. Okay. So if the knowledge is to be a good and the subject may be having the better health practices. It may be a positive or it may be a negative. So which has to be tested scientifically by experimentally. So this is the hypothesis formulation. Usually for experimental study, we have to formulate the null hypothesis. Null hypothesis means there is no relationship between the knowledge and the practice. And after the study result has been come, and we have to conclude the study that whether the hypothesis has to be accepted or whether it has to be rejected. And next is hypothesis answers the research questions or research objectives. So hypothesis is to be very important one. The entire research questions are answered by the formulating the hypothesis and the acceptance or the rejection of a particular hypothesis. And phase two start with the design and the planning phase. The second major phase of quantitative study is the researchers make decisions about the methods and procedures to be addressed and the research questions and research plan for the actual collection of the data. Here, the research design has to be selected and the planning for the assessment and how it has to be done and the intervention and the post assessment. So everything has to be planned and which tool the researcher is going to use for collecting the data, the period of time, okay, when she's going for the data collection. So the entire aspect has to be planned. So this phase we call it as the design and the planning phase. Phase two, the design and planning phase includes selecting a research design and developing intervention protocols, identifying the population, designing the sampling plan, specifying the methods to measure the variables, developing methods to measure the variables, and finalizing the research plan. Step 6. Selecting a research design. In designing the study, the researchers specify which specific design will be adopted and what will be done to minimize the bias to enhance the interpreting of the results. Okay? This is according to the research problem. The researchers must choose the appropriate study design. For example, experimental study, experimental design or quasi-experimental design or non-experimental design, descriptive design, evaluative design. It's to be many types of designs are available and what kind of the research questions has to be taken and according to that intervention is present or intervention is not there, randomization is present or not. So according to that the investigator is going for experimental design or a quasi-experimental design if no intervention are there. So that time she takes the non-experimental research design or a descriptive research design. Example, randomized control trials. Under the randomized control trials, it is to be coming under the two experimental research design, randomization and the control. Both will be there. And double-blinded randomization method is to be there. Double-blinded in this randomization, both the subject as well as the investigator, they do not know each other. So that will be minimizing the bias and enhances the result accuracy. Step 7 is developing the protocols for the interventions. In experimental research, researchers actively intervene and create the independent variable, which means that participants are expected to different the treatments and conditions. Okay, so what intervention the researcher is going to perform in the study? It may be exercises program, or it may be educational awareness program, or any packages and yoga therapy or whatever it is. So the intervention package, the intervention has to be music therapy or whatever it is. So the intervention has to be well planned. Okay. Next is, in case of a non-experimental research, of course, this step is not required, and the researcher need not to prepare any intervention plan. Next, we'll move on to identifying the population. Quantitative researchers need to know the characteristics of the study participants and clarify the group to whom study results can be generalized, and that is, they must identify the population to be studied. Okay, so which population I'm going to study? The investigator going to study. It may be a school children or adolescent children or a postmenopausal woman or postnatal mother. So the group has to be identified, and also the characteristics of a particular sample should represent the population. Step 9 is designing the sampling plan. In quantitative study, a sample adequacy is assessed by criterion of representativeness, typical representative of the population, and the sample size. Criterion of the representative means it's an inclusion criteria, and the exclusion criteria has to be drawn by the researcher. Inclusion criteria means the age group between 15 to 25 years or 30 to 45 years. Okay, that should be more applicable according to the disease process. And next is the typical representative of the population, and it means that which group of the people, adolescent or to be a men or a woman, and older people or postmenopausal woman or whatever it is. So, and the sample has to be selected, and also the sample should have a similar characteristics so that the sample will be accurately represent the population. And next we have to determine the sample size, and the sample size will be estimated by the sample size calculation. Step 10, specifying the methods to measure the research variables. Based on the conceptual definitions, the researcher identifies or decides appropriate methods to operationalize the variable and collect the data. Which method I am using, which method I am going to collect the data, interview method or observational method, or many methods are available for collecting the data. So the appropriate methods as even biophysiological measures. Biophysiological measures, here the investigator are using the medical devices and collecting the data. For example, the BP apparatus, and with that she's checking the BP and collecting the data. And in case of the interview method, if the woman is to be a woman or a sample, whomever it is, they are not to be well educated, they'll go for the interview method and they will collect the data. And the practice aspect will be observed by the observational method. So appropriate method has to be chosen for collecting the data. And step 11 is developing methods to safeguard the human rights or animal rights. Most nursing research involves human subjects and few studies involve animals. In either case, procedures need to be developed to ensure that the study adheres to the ethical principles. So the researcher must follow the ethical principles, which includes the privacy, confidentiality of the data, and there should be a more advantages to the subjects and very least disadvantages to the study participants. So care must be taken that the subject should not be distracted or disturbed by any of the investigations or any difficulties given by the investigator. And study participants are protected by in obtaining the informed consent from the participants. In that informed consent, detail about about their research study and they have the voluntary consent. It should not be forced, and at any time they can withdraw from the study. And the contact number and the details and alternative methods, everything has to be included in the informed consent with the participant signature and the witness signature. So this will be protecting the study participants. And the ethical clearance. Ethical clearance has to be obtained by the investigator before conducting the pilot study. An ethical committee is formed in an organization, and the experts they will give the ethical clearance. So that will be protecting the human rights. And before going for the study, the permission is obtained from the authority of a particular study setting, so that we are protect and safeguard the human rights. Step 2, reviewing and finalizing the research plan. Before actually collecting the research data, researchers often perform their trials to ensure that the plans will work smoothly. This can be achieved by content validity from the experts, reliability of the research tools, and conducting the pilot study. Content validity from the experts in the field of medicine and the nursing, and the particular content has to be given, and we have to give the suggestions and the opinions, and their suggestions and opinion has been incorporated in the study. And reliability of the research tools has to be checked for the reliability, and many methods are available to check the reliability. Example, test and retest method. Whomever they are using the research tool, it should give the same answer, so that the accuracy has to be enhanced by checking the reliability. Next is the conducting the pilot study. By conducting the pilot study is otherwise called as the parent study, and any difficulties which has been undergone by the investigator has to be modified by conducting the pilot study. And phase 3, the empirical phase. The empirical phase uh, portion of quantitative studies involves collecting the data and preparing the data for analysis. Empirical phase is the time-consuming phase of the investigation represented by the Gantt chart. Two activities are involved. One is collecting the data. The implementation of your research has to be done in the empirical phase, collecting the data and preparing the data for the analysis. So the entire data collection period has been represented by the Gantt chart. And step 30, collecting the data. The researcher's plan typically specifies procedures for the actual collection of the data. Example, assessment of the client's cases before and after the treatment in case of the case control studies. The activities during the data collection is represented in the Gantt chart. So in collecting the data and according to the data collection plan, by using the research tools, the investigator has to collect the data. For example, in case of the case control studies, before and after the treatment, and we have to collect the data. Then the data collection procedure, the assessment, intervention, and the post-assessment in the study group and the control group, and everything, the activities, all the activities which has been done during the data collection has been represented in the Gantt chart. Step 14, preparing the data for analysis. In preparing the data, the preliminary step is coding, so that the investigator has to prepare the coding sheet. While we are preparing the coding sheet, the name should not be there. Instead of the name, we can use any code number, and so that we are able to and protect the privacy of the subjects, and also we are able to maintain the confidentiality of the data. Phase 4, the analyzing phase. Quantitative data gathered in the empirical phase are subjected to analyzing the data and interpretation of the study results. Step 15, analyzing the data. To answer the research questions and test the hypothesis, researchers need to process and analyze this data in orderly and coherent fashion. And so that we require some statistical procedures. SPSS statistical package has been used for analyzing the data. Descriptive and the inferential statistics. Descriptive statistics, standard deviation, mean, median, inferential statistics, chi-square test, and the t-test, ANOVA test, and these all the tests are used for the inferential statistics, and which has been used for analyzing the study results. Step 16, interpreting the results. Interpretation is the process of making of the study results. So the researchers attempt to explain the findings based on the objectives and the hypothesis. The study results has to be answered to the objective and the hypothesis. So all the objectives has to be answered by interpreting the study results and the hypothesis, whether it has to be accepted or whether it has to be rejected. Okay, this has to be answered. And study results determines whether the hypothesis is accepted or rejected. Then phase 5, dissemination phase. In dissemination phase, the study results are shared with the others, and by communicating the study findings and then utilizing the findings in the practice. Then step 17, communicating the findings. Final task of the research project is the preparation of a research report that can be shared with the others. And the research reports can be in various forms for the research project, the PhD students and dissertation MSc students and PhD and the thesis PhD students are doing. And research study can be published in the journals, and also the scientific representations can be done in the conferences. Step 18, utilizing the findings in the practice. Although nurse researchers may not themselves be in a position to implement a plan for utilizing the research findings, they can contribute to the research report recommendations in nursing education, nursing administration, and the nursing practice. EPM is a recent concept about the utilizing the research findings into the practice. Okay, integrating the research findings into the practice, and initially it is quite difficult to implement the research findings, but anyway we have to slowly follow the practice of EBM that will be helping to improve the quality of nursing care. Such process provides guidelines for the investigator so that the researcher is able to access the target successfully, so that the time waste will not be there. It will be methodologically guiding, systematically guiding the researcher, so that the research methodology will be enhanced. And finally, the research questions are answered by a systematic research process. Thank you.